Welcome back to Ebru Today. Dr. Vincent Eletto, our medical expert, here now to discuss the warning signs of stroke. Good to have you here.
And good morning.
Can you define stroke for me, first of all?
Yes, stroke is two types of strokes. One is a stroke that occurs because the blood flow is impeded to the brain, a certain part of the brain. The other is an actual bleeding into the brain.
Okay, so when you say a blood clot, I think blood clot when I think of stroke. Is that what it means?
Yeah, or plaque. It's a sticky substance that it builds up with age, or it can come from another part of the body, and it travels and lodges into one of the smaller vessels in the brain.
All right, well, who's at risk for a stroke?
Well, first off, anyone age 55 or greater. We can't help that.
55? I was thinking it was something more like in the 70s and 80s.
Well, 70s, we often see people in their 70s getting strokes, but anyone, as you age, the natural aging process will narrow the arteries. But diabetics, hypertensives, people with atrial fibrillation, people who drink heavily, smoking, inactive lifestyle, obesity, these are all people who are at risk, high cholesterol.
But this is not anything that is clear-cut. Anyone can have a stroke. I've heard of young people having strokes who have led a clean, healthy lifestyle. So how do you protect yourself?
The young people who have those are usually because there's a defect in the heart. It's called a patent foramen ovale. It's a small little hole that did not close at birth. And unfortunately, yes, that's what usually the young people have strokes from. All
right. Strokes can come out of the blue. Are there warning signs? And if so, what
yes.
are they? Okay.
Yes, there are warning signs. For instance, visual changes, difficulty walking, difficulty speaking, paresthesias, the sensation of needles, pins and needles in the arms, the leg, paralysis on one side of the body. These are difficulty speaking, difficulty understanding what someone is saying. These are all warning signs.
But these also mimic other conditions like a heart attack. Every time I feel my arm go numb, I'm thinking, ooh, am I having a heart attack? When maybe I've just been sleeping on it the wrong way.
That's very true, but the layperson can't make that distinction. So the layperson should get themselves seek medical care at that point.
All right, when do you know to call 911? Because we don't want to be, and I want to discourage people from going to the ER, but every little hiccup, so to speak, you don't necessarily want to go to the ER. So when do you know it's time to call 911?
Well, when these things are persistent. In other words, when you feel this, and it's very different when you're not able to use your arm. You can't pick it up. When it involves more than just your arm, it involves your leg, it involves the side of your face, with the difficulty speaking. These are times you need to get medical attention.
I want to get into some of the ways that you can help prevent by healthy eating, but sticking on this topic of getting to the hospital, it's important that you go to the right health care provider if you're having a stroke. Am I correct?
That's correct.
Okay. Explain why.
There's two types of centers. There's a stroke center, and there's a comprehensive stroke center. The stroke center has people who are trained to recognize the stroke and to give what's known as TPA, a clot buster.
Okay.
If you go to a comprehensive stroke center, these people are specifically trained in interventionalism. And what that means is they can take you to a suite and actually go in to that vessel and retrieve the clot. Or they can give TPA directly into that clot.
You're a family member, you've gone and you see that somebody on the floor is in distress. You don't know what's going on. You just call 911 and rely on the professionals to do their job. Is there something that family members, friends can do to be more proactive?
Calling is the most proactive
Call
you could
911.
do.
All right,
absolutely.
Well, let's get into some of the healthy decisions that we can make to ward off. We know we can't completely prevent stroke and many diseases, but what kind of steps can you take to perhaps maybe avoid it?
Healthy eating is number one. That's very, very important. Keeping your fluid status up is very, very, you don't want to dehydrate. You want blood flowing to your brain. Keeping yourself, if you're a diabetic, keep that sugar under control. If you're overweight, lose that weight. If you have a family history of stroke especially, you want to make sure that you follow a healthy lifestyle and get yourself into a regular workout program.
Now, you're an ER doctor. Clearly, you've seen many cases of this. Have you had any personal experience with any of your friends, family members?
No, thankfully, I have not.
Oh, that is good.
I had an uncle, distant uncle of mine, who did have a stroke. It was hemorrhagic. He had a brain aneurysm. Unfortunately, once it burst, he expired from it.
There are some cases that are so severe that there is no recovery, but if you get aid immediately, is there hope?
Yes, within 4 hours. We try to get people within 4 hours of symptoms. If they come to a comprehensive stroke center, odds are we can help them. It all goes by a score, and with each deficit, the score goes higher. We try to intervene more and more.
All right, so the faster you get to 911, the better your chances are, but eat healthy in the meantime. Dr. Vincent Eletto, we thank you again for your medical advice. Good to have you here.
Thank you again.